There is no alternative medicine. There is no parallel therapy. It's not possible. To take the best of the conventional medicine and the best of complementary medicine, and you take it together. Today, it's like that. But I'm sure one day it will be like that. It will be only one medicine, integrative medicine, because in the center of that, there's a patient. And that's the most important. It's a patient-centered cure, care, etc.
If you had an Australian or an American oncologist sitting in front of you right now that doesn't want anything to do with homeopathy, that thinks it's poo-poo, what would you say to them to open their minds, to just have them consider using homeopathy alongside, or at least recommending homeopathy to their cancer patients? Is there something that you can say to them?
First of all, I explained to him that
imagine a beautiful facility for cancer patients with luscious green grounds and trees where the practitioners all come together in a single building, giving homeopathic advice, aromatherapy, doing visualization exercises with their patients, and the patients then having lunch with all of these various practitioners in one place, and it all being paid for by the government, meaning no out-of-pocket expense for that patient. It sounds too good to be true, but today's guest, Dr. Jean-Denis Bogot in Strasbourg, France, actually has this facility. It exists. It's not a dream. It is almost too good to be true and almost too hard to believe for any of us living in Australia and many parts of the rest of the world to fathom that such a place exists, but it does. And these patients are getting the most incredible level of integrative care where various natural therapies are being used alongside their conventional oncology treatment. I am so excited to have our guest on today, Dr. Jean-Denis Bogot, and you can check out his website, shisso-info.com, for some more information. I really hope that if you find today's episode useful, that you will forward this on to your oncologist, that you will forward this on to family and friends, because it is possible for the rest of the world to have this type of integrative care, not just in oncology, but in all facets of conventional medicine as well. Now really is the time, more than ever before, for homeopathy to be embraced in an integrative way with conventional medicine. It can be done, and it takes all of us to stand up and demand this level of care. So thank you so much, Dr. Jean-Denis, for coming onto the podcast today. I know you'll enjoy this episode, all of our listeners. Thank you so much for listening.
Welcome to the Homeopathy Hangout podcast, where we discuss all things homeopathy from around the world. And now our mum and your host, Eugenie Kruger.
Hello, homies, and welcome back to Homeopathy Hangout, where we have an extremely exciting guest for you, Dr. Jean-Denis Bogot. Welcome, Dr. Jean-Denis.
welcome.
I hope I've pronounced your name correctly. I was just saying to you before, everything sounds better in French, and I've probably butchered your name. But the important thing is the incredible information that you're going to be sharing with our listeners today. To have found a French oncologist that uses homeopathy just blew my mind. And I'm so excited for you to share your information with us today. And when I heard that you presented this at the Homeopathic Research Institute's conference as well, I just think this is the type of information that our listeners around the world are really going to resonate with. Now, I did warn you that we have a tradition on the podcast where all our guests have to tell us how they were first introduced to homeopathy. So I would love to hear your story, please.
Yes, but first of all, I have to precise that I'm not oncologist at all. I'm a general practitioner, but I work in oncology center. So my practice is to see oncological patients and to treat cancer patients for 25 years. So that's my job, but I'm not oncologist at all. I think in Germany you have one oncologist, which is homeopath. I know, but there's not so much oncologists using homeopathy. But in France, some oncologists know homeopathy and use it. But I'm not oncologist. That's the first point.
Thanks.
So what is your first question?
How did you find homeopathy? How did you first learn about homeopathy?
Oh, it was at the beginning of my studies in medical studies. I was internist and I work in a hospital and I have 20 beds and 20 patients to care. And sometimes I couldn't help them. I couldn't help them because it was too difficult. And my chief told me, if you have a problem, you ask this doctor. So I asked this doctor, and this doctor was homeopath. And he came and he sees the patient. Okay, it's not difficult. I will give you something. And he gave him some homeopathy, and the patient feel better. So I was thinking, it's very strange. I have to know that. I have to learn this medical approach. And that's what I did. And it was at the beginning of my life of doctor, and I never stopped to use homeopathy because it's very easy to use homeopathy when you use it like an integrative therapy, an alternative therapy, but integrative therapy. So sometimes I use cortisone, antibiotics, and when I don't need them, I use homeopathy. And most of the time, I use homeopathy. But if I need some morphine, for instance, for pain, I use morphine, of course. So that's integrative medicine, and that's what I would like to share with you today. The idea of integrative medicine. There is no alternative medicine, it's stupid. There is no parallel therapy, it's not possible. Today, we speak about integrative therapy, and that's very nice. You take the best of the conventional medicine and the best of complementary medicine, and you take it together. Today, it's like that. But I'm sure one day it will be like that. It will be only one medicine, integrative medicine, because in the center of that, there's a patient. And that's the most important. It's a patient-centered cure, care, etc. So that's what I like my job, and I would like to work all my life. I don't want to stop. I don't want to retire. I just want to continue because it's a wonderful work that I do. I don't know what is better to help somebody which is ask you some help. Please help me, doctor, help me. So that's wonderful to have some key tools to help this patient. And homeopathy is one of the most important therapy I use because there's no secondary effects. There is no interaction with cancer treatment. So it's very easy to use. And in France, many patients use homeopathy when they have a cancer.
When I hear you speak like that, I want to burst with excitement, but also cry at the same time that our doctors here in Australia and countries like America, that they can't have that or that they don't have that same mindset. I have met an oncologist here in Perth who actually listened to my podcast and he said to me, Eugenie, I wish I could use homeopathy with my cancer patients, but if I do, they would strike me off the medical board and I won't be able to practice. And for medicine to have a Hippocratic oath, first do no harm, you would think that doctors would do everything they can to help the patient and not lose sight of the patient and using whatever means they can to help them. And I really hope that our doctors around the world that don't think in this integrative way that you do, that they can open their minds and start thinking in this way. Do you think the French as a nation, are they a bit more open-minded? Are they a bit more accepting? Are they a bit smarter? What is it about the French doctors that they're so accepting of homeopathy? Because it's not uncommon for medical doctors in France to use homeopathy, right? Or to at least be
Yes.
able to work alongside. Over here,
You
we get
know,
shunned.
historically, France was the first country in homeopathy with Germany. It was historically the beginning of homeopathy was in Germany and in France. So there is a long tradition in France. But we have to say, in France, homeopathy is a medicinal therapy. It's a medicinal product, so it's official. I am a doctor. I can say that I'm a homeopath. I can share my practice. I can explain my practice. And I can write, of course, prescribe homeopathy. But 4 years ago, in France, the government stopped the reimbursements of homeopathy because before, 4 years ago in France, homeopathy was free of charge for the patients. So now it's stopped and it's very difficult. It's not because of money, because homeopathy is not very expensive. It's because of credibility. Most of the patients say, it's not reimbursed because it's not useful. It don't works. It doesn't work. So that's more and more difficult in France. And the second point is I was a teacher in the French in Strasbourg University, and I learned homeopathy in the university, and it was an official diploma degree, but it stopped now for 4 years. It's finished. So we have no young doctors practicing homeopathy, and that's a very important problem. So the question is, what is the future of homeopathy in France? Perhaps it will be like in Australia. It will be practitioner, non-doctor. I don't know. But for the moment, it's only doctors in France, but perhaps tomorrow it will change. It's not, I think, a good idea because there is a place for both. I think you can be just practitioner of homeopathy and help many patients. But sometimes, of course, you need to have the point of view of a doctor, of course. And this doctor must be also homeopath, I think. So if it is not the case, like in Australia, it's complicated. It's very complicated for the patient because you don't understand. Why do you give me pills when I only need granules, when I only need homeopathy, and you give me some pharmacological products, and it's not good for me. I'm not used to take it. So I don't know the future, but today, of course, in France, in Europe, most of the countries are official doctor homeopath. But I don't know tomorrow. That's the problem.
Oh my gosh, it's a bit scary, but there's definitely, I feel that there's a trend worldwide, especially after COVID, of people embracing homeopathy. So hopefully it'll be on the upward trend in France again. Now, I saw some YouTube videos, like little clips of the presentation that you did at the HRI conference, and I know that you have some slides for us today that you can share with us as well. Would you mind
Yes,
sharing some of the slides
yes,
with
of
us?
course, because
And yeah, I'd love to hear about
I can
SHI.
share you some slides.
Thank you.
First of all, perhaps this one. This one is
So, but maybe tell us what is SHISSO and when you started it and why you started it.
because it's homeopathic research institute. It's an institute for researchers. And when I do many research on my topic in oncology called supportive care, and I publish some articles, and sometimes HRI help me to publish, to give me some advice to publish. And in this study, for instance, we try to see how many patients use homeopathy in France, in Strasbourg. It's my city. Strasbourg is the capital of Europe. And that's the different study in France with cancer patients. And as you can see, the first ones from Simon, it was 2005, and it was in Strasbourg. It was only 70%. And in only 12 years, we go to 31%. So it's growing, it's growing. And as you can see, homeopathy is the most used complementary medicine in France, much more than acupuncture, for instance, and much more than other therapy like aromatherapy.
That's amazing. Just for our listeners who are not watching the video, who maybe are just listening to the audio only, the first slide was just the percentage of people in Strasbourg that use homeopathy was it with oncology, right? 2005, it was 17%. And oh no, that was just not for cancer. It's actually just in general, right? In
No,
general,
it's for cancer. It was
just for
cancer
cancer.
patients.
Wow. Okay. So
Yes,
17% of them in 2005. And then in 2017, it was 31%. So basically,
in the same town in Strasbourg, France.
yeah. So one in three cancer patients were also using homeopathy. That's amazing.
Yes. And it's the most used complementary medicine used by the cancer patients.
So by 65%, and then
Percent of the among complementary medicine users.
so of all the complementary medicine that's used, 65% homeopathy. And the next
That's right.
closest is 33% for physiotherapy. And then much less, you've got aromatherapy there, 2.8%. That's incredible that homeopathy is
Yes,
so.
and the degree of general satisfaction is very high, as you can see. The patients are very happy to agree with the results of homeopathy, high degree
Amazing.
of general satisfaction. I like the slide. Perhaps you could explain to the people who can't see the podcast, but we asked to the patient what are the symptoms where homeopathy works the best. And it was very surprising because, first of all, it was for fatigue, and fatigue is the first symptom in oncology. So we were very happy to see that because it was very surprising. And the second symptom was pain. And if you want, you can continue to explain to your.
Yes, this is incredible. So this was from 2017 by the looks of it, and more than 90% of the patients were satisfied with the improvement in their fatigue. And most surprisingly, I would say, is that it's more than 90% for pain, because I think sometimes it's easy for us to think that, oh, homeopathy can't really help with pain. You need opioids or something like that. But for it to have such a high rate of satisfaction for pain is incredible. Obviously, nausea and vomiting is right up there, which I think most of us would think that homeopathy is great for that. And obviously, anxiety is up there as well, sadness, diarrhea, insomnia. But I heard you say something interesting in your talk, that dry mouth, that there's not actually anything medically that can be done for the symptom of dry mouth that
Yes,
often occurs with
it's
oncological
difficult.
care.
You can take some lemon juice. It's very good for dry mouth. You can eat a lemon, but there is no treatment for that. So it's very interesting to find homeopathy to treat some symptoms without treatment. That's where we are very useful, in fact. If you have anxiety, sadness, that's symptoms very frequent, and there is really no medical treatment because you don't take anxiolytics and antidepressive pills. When you have a cancer, you don't want to take some too much pills. So it's very useful to use homeopathy. And we created in 2016 the first homeopathic society of supportive care in oncology. And the idea was to facilitate and develop the practice, the teaching, the research, and the promotion of homeopathic therapy in supportive care in oncology. And we did many recommendations that's called homeopathic guidelines in oncology. And you can find these recommendations online. If you go to our website, you can find information in English and you can find the official guidelines. And you can use it if you want to, if you are a patient with cancer or if you want to treat some patient with cancer, you have many ideas and many tools to help these patients. And you can, of course, on our website, you can read our paper, and it's a scientific publication, and where you can find our recommendations. Do you want I share with you the place where I work in
Yes,
Strasbourg?
yes, please.
Yes. Okay, so it's a very pleasant place. It's the first one in France, and but now we have other place in France who do the same. We opened that place 6 years ago, and it is a outpatient hospital for integrative care, and I will show you how it is. Because for me, each patient is unique, so we have to treat each patient as it was the first patient in my life. It's not the case, but it's a special patient. So we have to take care of him. And the patient came in the morning, and it's oncology patient. And for the main indications are fatigue, pain, neuropathy, emotional disorders, sleep disorders, and the patient came and we meet him around a cup of tea or
Mm,
coffee and we discuss together. And the patient see the nurse and she explains the different kind of care during the day. And then the patient see with the nurse which treatment he will have during the day. And when we have a consultation with the coordinating physician, that's me, and there's a validation of the care plan because to see which treatment the patient will have. And of course, we take account also to all the story of the patient. And then there's a consultation with the homeopath and with the acupuncturist. And in homeopathy, there's an individualized homeopathic treatment. We choose the treatment for the patient and not the treatment for the symptom. It's a treatment for the whole body, global treatment. And that's how I work. I try to find the constitutional homeopathy treatment of the patient, and I can use, if necessary, isotherapy, organotherapy, or symptomatic medicine. Do you know what is isotherapy?
Yes, so using a remedy made from the drug itself.
That's right. Yes, because many of the patients take its targeted therapy. We call that in oncology. Targeted therapy are pills who go exactly where the problem is for their cancer. But this targeted therapy have sometimes many side effects. So I use this targeted therapy in homeopathic dilution. And if the patient takes the pill in the morning, I give him the isotherapy in the evening. So I can balance the tolerance of the treatment, and the patient feel better with that. It's very easy to use. And the dilution that I use is in France 7C, but in your country you can find it in 6C, if you can find it, because you have to find this kind of treatment. It's very difficult to find it. In Strasbourg, we have a special pharmacist who do it for me, exact what I want in homeopathy. But if a patient take, for instance, cortisone in
Like a
conventional medicine,
pharmaceutical.
you can use cortisone in 7C or 9C in the evening, and the patient feel better and can sleep and is not excited and is not too hot and is not too big and too red. So you can balance the side effects with the therapy. It's very useful. Organotherapy is different. Organotherapy, you take a dilution of the organ who have problem. For instance, if the blood cells are very less, if you have not enough red cells or white cells, you can use a dilution of medulla osseum. Medulla osseum in
Bone
English.
marrow. Bone marrow.
Thank you. A very low dilution. You try to find it in a dilution 4C or 6D. That's better. If you can find it, it's difficult to find it. In France, it's easy, but in your country, perhaps it's difficult. And this will help your bone, how do you say?
Bone marrow.
That's right. To produce red cells, to produce platelets, to produce white cells. So we use organotherapy in this case to help the organ. For instance, if you have problem with liver, you can use some dilution of liver, etc., etc. And then the symptomatic remedy, of course, is very useful if you have a patient with nausea, which is vomiting. You can use symptomatic remedies. Sometimes it is nux vomica, sometimes it is ipecac, sometimes it is colchicum. It depends on the symptoms, of course. And after, at the end of the consultation, we try to find the constitutional remedy. If you don't find it, it's not very important. Perhaps you can find it in the second consultation or in the third consultation, but always try to find the constitutional homeopathic treatment, because if most of the time you have a big polycrest, as we say in France, big medicine, homeopathic medicine, like phosphorus, sonicum album, calcarea carbonica, thuya, lachesis.
Lycopodium.
Yes, lycopodium, of course. So we try to find it, sepia, of course. We try to find it, and if we find it, we can give it every day or every week to reinforce the general body. That's the idea. So I like this schema because it's how I work. Sometimes I give only one remedy, sometimes I give three, sometimes I give four. It's depending on the symptoms, on the situation. So every patient is different, of course. That's why I like homeopathy.
I am very
So
excited to see you prescribe in that manner, that you're using all the different ways of prescribing that we have. You know, we've got organotherapy, we've got isotherapy, constitutional, symptomatic, and you're not saying, no, it only has to be constitutional. You're actually making use of all the different ways. Well, not all, there's even more,
yes,
but making use of various different ways of prescribing to support the patient where they're at. I have a question for you though, because I often use isotherapy as well. So if a client of mine is taking antidepressants and they have to continue taking it for whatever reason, I will often give them the isotherapy of that drug as well, but I will tell them to take it at the same time. For the main reason of practicality, I get them to store the two together and I say, when you take your antidepressant drug, take the remedy at the same time so that they don't forget. But do you think it makes a difference if you take it together or opposite ends of the day? Do you have a clearly you have a preference because it sounds like you take it the other end of the day.
in fact, I don't know. It's my, I'm used to do that. Perhaps what you do is better. I don't know. Is that the point? We need studies. We need
Yes.
studies because I can't answer to your question because I don't know, in fact. So I just share with you my practice, but I'm not sure it's a better one. I explained to you how I do for 25 years. So I have a big experience with isotherapy. I think I prescribe about, I think, 10,000 patients with isotherapy. So I know how it works because I'm very useful of it. And sometimes people say, "Oh, if you give isotherapy, the conventional therapy will not work." It's not true at all.
No,
Not
in
true at
fact, it
all.
probably works like it works so well together. And I've seen that time and time again where people are able to
Yes,
tolerate their pharmaceutical medication better. It's like it brings out the
yes,
best of both worlds.
yes. In my best dream, sometimes if I have a dream, I really hope that when you buy a box of paracetamol, for instance, when you buy a box of paracetamol, inside you have also paracetamol pills in 7C.
That is a dream I'm happy to share with you. I think that's a beautiful dream.
No, because it works so well. It's very easy to use, and everybody can use it. If you have a problem with conventional therapy, and you need to continue, of course, continue this therapy, and just take this therapy in 7C every day, 3 pills, and you will see that you will feel better. It's very easy to experiment. You can use it very easily.
Absolutely. Even clients, I have a client who has had her thyroid removed. And so she obviously has to be on thyroid medication for the rest of her life. Otherwise, she would die. But she can use homeopathy alongside to counteract the side effects, although thyroid medication tends to be tolerated quite well. But still, it's easy enough to do. It would be great if it's
Yes,
accepted more widely, even amongst homeopaths, because some homeopaths don't like doing it. But it does work because at the end of the day, we want to do what is best for the patient.
that's right. So I show you the other treatment you can have in this.
For anyone who listened on the podcast and didn't see the visual, the grounds of your clinic is beautiful. I love the trees, it's so green, and the building is gorgeous. I'm
And you
sure people
know,
feel relaxed when they just even
yes, and
arrive
you know,
there.
it's in the city center of Strasbourg. It's just near the cathedral. It's in the center of Strasbourg. It's wonderful. So we have acupuncture, we have auriculotherapy, we have, of course, sociobiotician. It's very important care. And we have a psychologist, hypnosis, virtual reality, headset, mindfulness, of course, and that's important because we do mindfulness together, nurse, doctors, and patients together to be on the same level. And at 12, we eat together. It's called the therapeutic meal. And
So
we
you're
eat,
having a meal with your therapist, so your
that's
acupuncturist,
right.
and your homeopath, your acupuncturist, and your that's incredible.
Yes, we published a study on this topic. It was the first time in the world that we have a publication on therapeutic meals in oncology. It's the first one in the world, and we published it 1 month ago. It's a very new publication in a Journal of Integrative and Complementary Medicine. It's an American journal. So we together, it's very nice and very pleasant. And we can speak about the life. We don't speak about the disease. We don't speak about what I need to eat. No, no, no. We speak about life. That's wonderful. I like this moment. And in the afternoon, you can see dietitian, reflexology, aromatherapy, and osteopathy. All these treatments are free of charge for the patient because it's reimbursed by the French National Health Service.
Are you
That's very
serious?
important.
This is mind-blowing. It's incredible.
It's paid by the government. It's not paid by the National Health Service in France because it is in an hospital. It's an hospitalization. It's a outpatient hospitalization.
Wow.
So we have art therapy to find one's identity. And at the end of the day, the patient go home. And I hope they go home reinvigorated.
Do you know what I would like to see is a study of the outcomes, like the health outcomes of people who attend a center like this versus the health outcomes of somebody in Australia who's just shoved into a hospital and had a drug shoved in their vein and then sent home.
Yes, we published a qualitative study because quantitative study is very difficult to publish, but qualitative study is very interesting because we ask the patients, what do you feel about this treatments, this hospitalization, and the patient explain their feeling, and we do publication with that. So the importance of that is to guarantee quality and safety of the treatment pathway. Every caregiver is a specialist of his complementary technique and is used to treat cancer patients. So there are nurses, there are doctors, they are all used to treat cancer patients. That's very important. They are very good specialists. And that's my team. I can see I'm blessed amongst women.
I see. Everyone looks very
Yeah,
happy.
yes, and I'm the only man. That's my team.
Oh.
Yes. And as you can see, it's free of charge for the patient because the patient is sent by the oncologist or is sent by their doctors.
And how long would they typically be an outpatient there for? Like how many sessions would they typically be?
One session per month because we have not enough place for all the patients. So if we see the patient every month.
Even just once a month, imagine what a difference that would make for somebody to receive that level of care. There's so much that you get in that month. It'll probably last you for the whole month until the next session with all that relaxation and visualization and sharing a meal. And it looks incredible. And those grounds are just beautiful.
So I
Well
would like
done.
to share with you now clinical case to explain you in the reality and the real life what is integrative oncology, what is integrative homeopathy. This case is very interesting. It was a 88-year-old woman, and she had metastatic breast cancer. And the oncologist said to this woman, we have to stop the treatment because you have too much side effects. So we can't continue. We have to stop. And the patient said, but if you stop the treatment, I will die. And it was true, in fact. And the oncologist said, you can go to see Dr. Bagot. I was in the room just near the consultation of the oncologist. And the patient knocked at the door and say, please, Dr. Bagot, do something for me. So welcome. And I see this patient with small metastatic indurated lateral cervical lymph nodes. And you can see on the photo the small metastatic indurated nodes of the patient. And the problem was the skin of this patient because she took capecitabine, and there is a on-foot syndrome, very important. As you can see, it's called erythrodysesthesia, and it was a grade 3. And so the oncologist need to stop the treatment. So I proposed to the oncologist to continue the treatment and to begin an homeopathic treatment. So the oncologist say, okay, we continue the capecitabine at the same dose, and I introduce homeopathic treatment. I give her many remedies because I have to be efficient. So I use, of course, petroleum, nitric acidum, Bovista because the foot was big. It was edema. You have edema in the foot. Capecitabine, that's the isotherapy, and ointment with calendula. And I propose to the patient to come back in 1 month. 1 month later, the foot was better, of course, and the patient continue the chemotherapy and continue the treatment. So I change the treatment, I change the dilution, 9C and 7C for petroleum, 9C, nitric acidum, 9C, Bovista, 7C, and capecitabine always 7C. And I see the patient 1 month later, and the foot was very clean. There is no problem, no fissures, and the patient continues the treatment. And as you can see, the treatment works because the lymph node metastasis disappeared. So this patient was in clinical remission, lasted 6 months with this treatment. So that's a perfect example of combination of oncological treatment with capecitabine, which is a oral chemotherapy, and homeopathy together. And as you can see, the treatment works and the side effects was less important, elevate.
Can I just say, for any of our listeners who are not watching on the video, who's just listening to the audio, we have just seen the most unbelievable images. And this is why I love photos, because a picture doesn't lie. And I think you said this lady was 88 years old, right? So you
Yes.
could imagine a weaker vital force. At 88, you would think, what can the healing capacity of an 88-year-old be who is metastatic cancer and having these incredible, her feet, like how you couldn't walk on those feet. They look awful. And for her to heal that fast in 1 month, and then that follow-up photo as well, where her feet are just healed at 88, going through chemotherapy. It's mind-blowing.
Yes, but every day it's like that from my experience. So that's why I want to share this example, because it is easy to see because it's with the skin, so we can take photo. But it's the same with fatigue, but we can take photo of fatigue, of course. But when we have a patient with important fatigue and you give there some homeopathy most of the time, of course, we can't say every time because it is medicine. It is very difficult to treat everybody, but most of the time we have better results and the fatigue is less important. So it's my life. I see it every day. That's why I would like to share it with you. And it's so easy to do. And the important point with homeopathy is to choose the treatment. You have to listen to the patient because you have no automatic treatment. You have the treatment of the symptoms of this patient. So you need to listen to the patient. So that's the first treatment because you listen to the patient. And the second point for me, my colleagues sometimes say, oh, please, they said to the patient, please stop to say all your symptoms because you have too much symptoms and I can cure all your symptoms. So I don't know what to do with all your symptoms. But for me, more the patient have symptoms, more it is interesting for me because I can choose easier the treatment, the homeopathic treatment. So the patient is surprised when he see an homeopath because he say, oh, it seems to be interesting in my case. Of course, we are interested of everything the patient say and everything the patient, how he moves, how he feel, how he's dressed, and so on. So it's like a detective. We have to see every details, and the patients feel that we are very interesting on him and her. That's why I like my job because I'm never tired. I stopped working because I like to do some sports and some music and to be with my family, of course. But when I work, I'm not tired at all because it's very pleasant to listen to the patient, to try to help him. And sometimes we have a solution where conventional treatments haven't solutions. So that's interesting to help this patient in this point, for instance, with the platelets. sometimes with chemotherapy, platelets go down, and the patient must stop chemotherapy, wait 1 week, 2 weeks, that the platelets grow, and then they continue the chemotherapy. But with homeopathy, you can use medicine very effective, which is crotalus. Crotalus is venom, you say?
Yes, venom of the snake. Yeah.
Of the snake, huh? And in homeopathic dilution, of course, and the platelets grow very quickly with that remedy. So I say to my patients, if you have problem with platelets, 2 or 3 days before you take your blood to have a check, and you take some Crotalus pills, and the platelets grow. And it's very easy to see because you see the results on the blood results. And it works very well. And there is no treatment for platelets in conventional medicine. So that's a good example of use of homeopathy in cancer supportive care, integrative cancer supportive care.
So for our listeners, Crotalus horridus is a great homeopathic remedy made from snake venom. And like you said, if there's no conventional care, then the medical profession's got nothing to lose. They can just try it. Just try it. And the blood work, will tell you if it's working or not. And if it's not working, that's fine. But if it's working, that's amazing.
There's no secondary effects. Sometimes with homeopathy, you have a reaction. You feel that it's not good for you. So you have to stop. You stop it. But that's all. You will never have a bigger reactions. So if you feel that the treatment is not good, you stop it. That's all.
Can I just say what fascinates me about listening to you speaking about the various treatments you have for your patients is if you were to speak to a conventional oncologist right now, they only have a handful of things that they can give to their patients to help them. And when they've exhausted those maybe 5 things, they've got nothing else. But with homeopathy, we have so many more options, so many more things that we can use to help our clients. So you never run out of ideas. And I'm sure that you see miracles in your clinic all the time with homeopathy. So I can imagine that your level of job satisfaction must be really high as opposed to conventional doctor who does not use any homeopathy, which after they've exhausted their handful of options have nothing else, and they have to say, I'm sorry, there's nothing else I can do for you. Whereas with you utilizing homeopathy, you always have something that you can do to offer them.
Yes, and of course, I know also that for some symptoms, homeopathy doesn't work. I know that also. I know where are the limits. And I explain to the patient, I'm sorry, but for this symptom, I can't help you. But we try for other symptoms. But we have to, it's not a miracle. It's not, homeopathy sometimes doesn't work because it's not enough. For instance, with chemotherapy, the patient lose their hairs. And homeopathy can't do anything for that, of course.
I saw that on your graph, that that graph that you showed with the conditions, and alopecia was right at the bottom with the lowest satisfaction from the,
of course.
Yeah, and I thought that was really interesting. But then at the end of the day, the body is not going to prioritize. If you give it a remedy which is going to stimulate the vital force to heal, I can imagine that the vital force is not going to prioritize the regrowth of hair. It's going to prioritize using your vital force to heal your internal organs rather than your hair. That would be my thinking.
Yeah, I agree. That's a word. I agree.
And I really want to ask you something else, because you spoke about this really interesting thing called N of 1 trials. I haven't heard of it before, but I think I understand what you mean by it. But I would love if you can say a little bit about what an N of 1 trial is, because to me it kind of sounded like you were doing like a controlled trial within one person or something like that.
That's right. If you want to evaluate homeopathy, you can evaluate with 50 patients in a placebo arm and 50 patients with homeopathic arm. That's randomized clinical trials. Okay. But you can use another kind of design. It's called N of 1. And you have one patient with a symptom, for instance, hot flush. And you want to know if homeopathy works with this symptom for this patient. So you give one remedy the first week, for instance, Sepia officinalis. The week after you use Lachesis mutus. The week after you use Belladonna. and the week after you use placebo. And of course, it's a randomized. You don't know which week it is which remedy, of course. And you ask the patient to note every day how many hot flush she have in this day. And at the end, you compare. And if you see that with lachesis, you have a response, very good response. With sepia, you have a response like that. And with placebo, you have like that. You can show that you have an effect with this homeopathy for this patient. And personally, I use that also not only in my research, but in my practice. For hot flush, for instance, I could give morning sepia, noon lachesis, and belladonna in the evening. That's one thing to do. But I can do also 1 week with belladonna, 1 week with lachesis, 1 week with sepia, and see the results. And if the patient, when she comes back, she said to me, "Oh, it was better with lachesis," I know that it's a good remedy for her. And I continue only with lachesis, for instance. And if I have no results, even with any of the three remedies, I try another one, glonoinum, amylium nitrosum, or so on. So sometimes I do that when I'm not sure and I want to see the difference. And when I hesitate between belladonna and lachesis, I'm not sure some symptoms are the same. It's difficult sometimes. So we can do it enough one. And in the trials, we can try and research to use it. It's interesting, but of course, it's not the real life. In the real life, we use not only one remedy, we try to find a constitutional remedy, we try to find a specific remedy, and so on.
And I heard you say that once you have discovered which of those remedies that you trial is the best, then you just have to figure out the right potency. And I was going to ask you about that. Do you ever use a home accord where you would use then, once you know this is the right remedy, would you then use like a home accord with different potencies of that same remedy in one bottle?
Yes, Omaccord is a very good idea. It's the same with Korsakovian dilution. And you have also, in some countries, you have a LM dilution. It's called
Quintessimal. Yeah, LM. We use
quintessimal
that as well.
dilution.
Yeah.
We have not that in France, but in Austria, in Germany, they have a Q dilution. In fact, it's very difficult to find the good dilution because it can change for the same patient. Most of the time, I begin with low dilution and I grow progressively. And at the beginning, for instance, I use a 7C and then a 9C. In France, we have many dilution possible: 7C, 9C, 12C, 15C, 30C. In France, the higher dilution is 30C.
I've heard that before, but then at the same
Yes,
time,
it's
you hear the
stupid,
French
but you can
homeopaths doing
find
amazing
you can
things.
find 200C because 200C is very useful too. So sometimes I send my patient in Germany and they buy 200C dilution. But I begin at the beginning 7C, 9C, and it's growing. And because sometimes patients say this treatment works, but now it seems not to work so well. So you have to change the dilution. But of course, Omaccord is good, Korsakov is good, Q dilution are good. You have to use what you are used to, or what you find in your country, because in France we can't find Q dilution. That's a pity.
So you have to. I have heard though, because I think it was Jerry Van den Bosch that I had on the podcast that talked about organotherapy, and he swears by the organotherapy remedies that is made in France, because apparently they do 100 succussions between each potency, not just the 10 succussions that most of the other pharmacies use. And he said using the 100 succussions apparently makes all of the difference, and that's why the French products apparently are the best, even in low potency. That's apparently why they get incredible results.
Yes, perhaps. I don't know.
Amazing. So I just want to ask Jean-Lenel, do you have any advice if you had an Australian or a American oncologist sitting in front of you right now that doesn't want anything to do with homeopathy, that thinks it's poo-poo, what would you say to them to open their minds to just have them consider using homeopathy alongside, or at least recommending homeopathy to their cancer patients? Is there something that you can say to them?
First of all, I explained to him that homeopathy is integrative oncology, is part of integrative oncology. So it's where, as I said at the beginning, it's not alternative medicine. So you can be sure that my patients will always take the conventional treatment for their cancer. If a patient asks me a homeopathic treatment of the cancer, I explain to him that it doesn't exist. It's not possible. So we have to, first of all, I explain that to the oncologist. Second point, I can explain him that there is no interaction with the conventional treatment. So you can use targeted therapy, hormone therapy, radiotherapy, and of course, chemotherapy. With homeopathy, there is no interactions. Third point, there is no side effects. That's the 3 points. Integrative, no side effects, and use during the treatment. No interactions. That's the 3 points important for me to explain. And of course, I am a doctor, and my objective is the same of the objective of the oncologist. We have to try to cure the cancer, to cure and to care of the patient. Cure and care together.
Oh, I love that. You've shared such beautiful information with us today, and you've just given me goosebumps. And I even had a couple of tears in there as well when you're talking about that center of yours where everyone's working together. And it's given me so much hope, and it's given me a new vision as well that it can be done. I think just more people just need to see that it is being done. Obviously, in Europe, people are a lot more open to natural therapies, I think. But yeah, it's really time that Australia wakes up and that America wakes up as well and has a bit more. Yeah, just a bit more into open-minded towards integrative care, I think.
There is a fourth point I could say to the oncologist, to say to him that even it is placebo, where is the problem? If I have results, that's the most important, even if it is placebo. I could say, okay, homeopathy is placebo, no problem. So just see my patients and you will see that they feel better. So I don't know how I can do that with my placebo treatment, but the results are there. That's the most important for me. So for me, it's not when I say homeopathy is placebo, I say, oh, yes, of course. But every pill is placebo. When you give paracetamol, you have also placebo effect also. And when you give homeopathy, you have also placebo effect.
That's a good point. I love it. You've also written a book. We should talk about that. Sadly don't have a copy of your book because I only just recently found out about it, so I haven't had time to order it. But can you tell us about your book and where people can buy it?
That's a problem because it's sold out. I need to have a re-edition. So I will send you the news of the re-edition, but for the moment you can't find it. So
okay.
this
I
book
like
is
your
in
I like your
English.
marketing tactic because we're like creating a little bit of excitement, and so when you relaunch a new book, it'll sell out. That was clever of you. No, that's great. Well, we'll definitely make an announcement when
Okay, thank you.
when you republish it. But also your website and social media and all of that. Do you want to tell us about that now? Can you share some of your links? We will also put it in the show notes, but just if there's anything that you want to say about how people can get hold of you or yeah, any final bits of information that you want to share with our listeners.
Okay. I could share with you some articles also.
Oh, amazing. But is there anything now that you want to tell our listeners, like any final message that you want to give our listeners or anything else that you want to share before we wrap up?
Okay, the life is beautiful. That's all.
Oh,
And I like my job. I think to take care of the patients, to take care of the patients. It's wonderful way of life, and I like it. That's all.
that's incredible. And you've got a big birthday coming up, I saw for next year. So a big celebration, I think.
Which
Like
one?
around, have you got your 70th birthday next year?
No, no, no,
No,
no, no. In 2 years.
in 2 years.
No, it's next year.
Yeah. Sorry. That to me is so inspiring. So I just want to
Thank
say
you, thank you,
thank you. I think it's
thank you.
amazing. I have another podcast guest. The episode's coming out, or actually, it'll be before this one that comes out. She's 80 and she is still practicing. And there's a homeopath in New Zealand. She is 90 and she's still practicing. And I'm trying to get her on the podcast as well. But God willing, hope that I will be practicing into my 80s or 90s, 100 if I make it, because this is the best career in the world. And we are so lucky to get to do what we do. Thank you for your time, Jean-Denis. I really appreciate it.
All the best for Australia.
Thank you. Bye.
Bye bye.